Hey, I put a video together. Now, I didn't actually make the video, but I did get permission to put the video up. I explained why, and so I got the okay and the thumbs up. Excuse me, to share the video. So I'm just letting you know what it's about. It's about cardiac rehab, and it's similar to what I go through on Monday, Wednesday, and Friday. Uh, but I wanted to share it. Unfortunately, I'm not allowed to make a video of me actually being in cardiac rehab because of the security of other people. That's why. So, but anyway, uh, here's something for you to watch. It's about cardiac rehab program. I think it's pretty cool. Check it out.
My name is Fred, and I'm here at the Cardiac Rehab Center at St. Mary's Hospital. The reason I'm here is that I had a heart attack.
So how would you rate this, your perceived exertion, Fred?
I would rate it as a 4. This program, I just can't say enough about. You meet a lot of good people. Everybody's here for the same reason. Everyone is real supportive, and it's an excellent program, and I would highly recommend it to anybody who has the situation that I'm in.
Feeling any symptoms, any chest pain?
Nope.
Okay, looks great. Keep it up. My name is Patrick. I am the coordinator for cardiac rehabilitation at St. Mary's Hospital. Cardiac rehab is a multidisciplinary rehabilitation program for heart patients. Heart patients meaning anyone from bypass surgery, person that's had a stent, person that's had the heart attack, maybe a valve replacement. 146 over 68. Looks good.
Good. Thank you. We're working it.
Cardiac rehab plays a real key role in the overall recovery. If a patient would leave after having a bypass surgery and not have any recommendations or guidelines in what to do as far as exercise, what are the activity limitations, how much they should lift, as far as weights at home, they might be really misguided. So when they do come to cardiac rehab, they're going to have a lot of guidelines as far as the progress they can make. A cardiac rehab participant would usually be enrolled in rehab maybe 2 weeks after their discharge from the hospital. The St. Mary's cardiac rehab consists anywhere from 6 to 12 weeks of rehabilitation. They'll come Monday, Wednesday, Friday. We're going to be monitoring their heart, looking at their blood pressure, EKG, seeing if they're responding appropriately to exercise. So as we're strengthening their heart, we'll see if there's any changes that are not appropriate. And then we can bring that to their primary physician, or we can bring it to our medical director, Dr. Jane Pearson, and she can address it at that time.
Dr. Jane Pearson of Dean and St. Mary's Preventative Cardiology says, "We know that combining necessary medications with important lifestyle choices dramatically decreases future risk of a heart attack. You have the power to make these choices every day of your life and to teach the next generation the importance of heart-healthy living."
Within 6 weeks, they'll usually see significant improvement in their quality of life, their energy level, and hopefully they're making some changes in their dietary habits as well. So hopefully they'll start seeing some changes maybe in their weight loss.
All right, one exercise left. We're going to do the triceps.
Overcoming the fears of bypass surgery or having a stent or having a heart attack and coming to rehab, I think it reassures patients when they get in the group setting, they see that these other people maybe are close to finishing their rehab that had the same event, and they're back to all of their activities that they were doing and back to work as well.
You can do the walking path, and there's, like you can see, there's all kinds of exercise equipment here that you can use, which they get you started on. You go so fast, and then you work so many METs, and they it keeps you going, and you just keep working your way up from class 1 to class 18.
A patient can return to a normal life after cardiac rehab, and in some senses, they may return to a more fulfilled life, a better quality of life, because if the person was not exercising, not following any lifestyle modifications, coming to rehab, strengthening their heart, which then in turn will strengthen the rest of their body, they might find they're doing more activities than they ever done before. Cardiac rehab is covered by most insurance companies. Medicare covers up to 36 sessions in rehabilitation, and then many of the carriers that we have around Madison will cover anywhere from 18 to 36 sessions.
I think what this class brought to me is that I feel more confident and stronger and just all around more fit. I don't worry about anything happening to my heart or myself. It's a big security blanket.
Cardiac rehab is fun, and we tried to make it an environment that people can joke, share with each other, and have a good time. Heart disease is very serious. However, when you're in the rehabilitation stage, it's kind of like you're on the downside of the hill. You're going to be doing some work, but the team's going to be there together. It's going to be the other patients, the staff working alongside with you to make it a kind of an enjoyable road to go on. And there we have our graduation diploma.
Yay!
Dun-da-da,
Yay!
dun-da-da. Fred has graduated from outpatient cardiac rehab, has overcome heart disease right here.
This is a fantastic program, and I'm glad it's here because it sure has helped me. And I've made some good friends here. And, I just wish everybody luck. And this is fantastic. Everyone's done a great job.